Teaching and Assessment of Evidence-Based Medicine.
Good day, everyone. Today, we embark on a journey to learn about a concept caused great interest among health professionals. We will introduce you to the evidence-based medicine, EBM. Evidence-based medicine represents integration of clinical expertise, patients' values, and best available evidence in process of decision-making related to patients' health care. Medical knowledge grows every day, so that previously accepted facts rapidly become old, and it seems impossible to find the time follow such explosion of scientific information. On the other side, even if the doctors find the time to read all of them, they would be lacking the time to evaluate the value of the study, its methodology, outcome, and transparency. That is why a need occurs that the doctor, with his limited time, read selectively, make effective selection of what he reads, and what not. Instead of routinely reviewing the contents of dozens of journals for interesting articles, EBM suggests that you target your reading to issues related to specific patient problems.
Interesting, how can we do that? I was suffering for long years.
The evidence-based medicine process involves several key steps. First, is constructing a structured question, formulating clinical scenarios into answerable questions using the PICO, patient, intervention, comparison, outcome, mnemonic. Second, literature searching, conducting comprehensive searches across various databases to identify the best available evidence related to the question. Third, critical appraisal, evaluating the identified evidence for its validity and applicability, requiring expertise in epidemiology and biostatistics. Fourth, is the application of results, applying the results of the evidence appraisal to clinical practice, involving the synthesis and communication of findings to relevant parties, including healthcare professionals and patients. And finally, the evaluation and assessment, assessing and evaluating the impact of the evidence-based medicine process within the specific clinical context where it was implemented.
I do not think it is easy. We are dealing with adults who need to feel the benefits of what they are doing.
Initiating this process is not easy. As a teacher, you need to encourage trainees to use the PICO structure to formulate questions. Moving on to the second step, trainees learn the art of searching for evidence and answers. Trainees may come with varying degrees of prior experience of searching the evidence base. More experienced trainees should be encouraged to guide and help their peers in small group activities. Students need to know how to look for the required information. From the PICO structure, a number of terms can be selected for the search under each separate heading. The selected terms can then be combined with or, and, or should be used to combine synonyms, terms with similar or related meaning, while and should be used to combine headings. Third, the critical appraisal, which transferring research knowledge into practice. It involves systematically examining research evidence to assess the validity of results, interpreting what the results show, and determining the relevance of the results using quality checklist. In the fourth step of evidence-based medicine, EBM, the focus is on integrating EBM with clinical judgment, taking into account individual patient circumstances, choices, and values. At this stage, trainees are encouraged to consider several factors before applying evidence to patient care, including assessing the quality of the evidence, considering patient characteristics and the clinical setting, evaluating the patient's baseline risk, determining the potential benefits of treatment, and understanding the patient's preferences and values.
Then, what do you mean is the transfer of learning for adults is not automatic, it must be facilitated? Coaching and other kinds of follow-up support are needed to help adult learners transfer learning into daily practice.
Yes, you are right. This will appear clearly in the fifth step. In step 5 of evidence-based medicine, trainees are encouraged to play a bigger role in evaluating current practices in light of newer evidence. Trainee presentations in journal clubs or clinical meetings are suggested as platforms for discussing and disseminating new evidence. When new evidence suggests a change in existing practices, teachers are advised to guide trainees in identifying potential areas for change within the organization, taking local issues into consideration and acknowledge their effort and congratulate them on their achievements, however small.
So, we need to have a holistic tool that can measure not only students' gained knowledge and skills, but also the impact of teaching evidence-based in clinical decision-making and health outcomes.
Before talking about students' gained knowledge assessment, I want you to know a term called competencies in evidence-based medicine, which refers to the proficiency and skills that students need to develop to integrate the best available research evidence with their clinical expertise and the values of their patients. To assess the impact of EBM education, the classification rubric for EBM assessment tools in education called CREATE framework was developed. 7 categories for assessing the outcomes of EBM education are provided by CREATE, namely, learners' reactions to the EBM educational experience, attitudes, self-efficacy, knowledge, skills, behavior, and benefits to the patient.
Is there any specific tool to evaluate EBM students' competencies?
Few instruments have been developed to assess EBM aspects, including knowledge, skills, attitudes, and behavior. The Fresno test and the Berlin questionnaire represent the only 2 prominent tools developed to assess EBM knowledge and skills.
What about other common assessment tools?
Multiple choice questions, MCQs, essays, and objective-structured clinical examinations are all forms of assessment that may examine, to a certain degree, learner competency in EBM. Yet, none of the above-mentioned modes of assessment have been developed and validated to specifically assess EBM competency in medical trainees. EBM provides us a way of keeping our practice up to date in the growing world of medicine. Not everybody needs to appraise evidence from scratch, but we all invariably need some skills in EBM to remain up to date with new research. The need to develop a curriculum outlining the minimum standard requirements for training health professionals in EBM is well recognized.